Health and Human Services announcing the state has reached its lowest recorded infant mortality rate in history. The most recent numbers come from 2023, where 607 infants died. That's a rate of 6.1 deaths per 1,000 live births. The year before, that number was 650 deaths, with a rate of 6.3 per 1,000 live births. Now, these numbers look a lot different when it comes to deaths among Black infants. While the numbers are a record low, it's still higher than the state average at 11.9 deaths. And a big reason for these lower numbers in the state, the additional funds to help community-based projects aimed at lowering the numbers. And joining me this morning to talk about the work that's being done is Dawn Shanafelt, the director for the Maternal and Infant Health Division at MDHHS. Thank you for joining us, Dawn.
Absolutely. Thank you for having me.
Why don't we just first start with the numbers? Trending in the right direction, but obviously more work still needs to be done.
Absolutely. So definitely trending in the right direction, and that's been happening in Michigan since 2019. In 2019, we had a lowest on record infant mortality rate. That happened again in 2021 and then again in 2023. So definitely moving in the right direction, but we need to continue the momentum that we've built in Michigan.
You know, we've covered stories about various programs that help growing families. I remember talking to Wayne County Executive Warren Evans about a program that was launching there to help young parents, parents in general. How do you feel these programs are working to lower that infant mortality by giving support to these growing families?
So this is definitely a long-standing public health crisis or emergency, whether you're in Michigan or throughout the United States. And when we grapple with challenging issues such as infant mortality rates, maternal mortality rates, we need to really work together. And that's why the community-based programs and the efforts that are supported through the state and the Michigan Department of Health and Human Services are seeing change being made right before our eyes, as evidenced by the data that was shared. So wraparound services such as home visiting. Michigan has done a lot to invest in home visiting, and our home visiting programs serve over 20,000 families every year. We've invested in doulas and access to doulas throughout the state, and particularly in January of 23, families of who have Medicaid insurance are now eligible to have a doula be part of their care team. And doulas have been proven to improve birth outcomes, everything from improving low birth weight rates, prematurity, really standing alongside a family. So I think when we think about the things that are working, it really, the adage that it takes a village really is true. And that's coupled with our efforts with the clinical community. So we've invested in Michigan's 75 birthing hospitals, employing proven quality improvement efforts and safety bundles that mean that our hospitals are ready in the time of an emergency. They're ready when families come in and everything is healthy and going well, but they also can pivot really quickly. And all of that is very, very important and was really spearheaded by Governor Whitmer's Healthy Moms, Healthy Babies initiative that launched in 2021.
And the one thing that I thought when I was reading into these programs is that it seems like you're thinking outside of the box, trying to reach people where they are.
Absolutely. So that's the root of public health. Listening to experts, and the experts are families and communities. So hearing what works well, hearing where the challenges are and addressing those with policy and investment. And again, capitalizing on things that we know that work. I mean, health is in the community, and that's really where the investments are happening.
And speaking about health in the community, we need to talk about Black infants and the mortality rate there, which is higher than the state average. What can be done to help young mothers, and families, growing families in the Black community to bring that number down?
I think we really need to focus on the fact that these are systemic issues. They are not the fault of the families, of the mothers and fathers and,
Right.
and families in the community. They are the result of systemic challenges. And so that's why we need change and investment that's across the board to address the challenges that are disproportionately affecting Black, Indigenous, and Hispanic families in our state.
Is there anything that stands out to you when it comes to what we could do to reach those communities in a more effective way?
What really stands out are adjusting systems to assure that bias isn't happening. So, for example, in the clinical space, when I mentioned hospitals, prenatal care, really having standards of care to assure that all families are receiving optimal care. They're receiving the best possible care to result in the best possible outcomes. Also, I think we need to back up a bit and delve into the time before and pregnancy and between
Yes.
pregnancies.
Yeah.
We really need to spend time and focus on the health and well-being of moms, right? It's necessary to assure that we have healthy moms going into pregnancy, and if moms aren't healthy, to do everything that we can to provide services and optimal living conditions, right? Poverty is definitely a contributing
Yeah.
factor to challenging birth outcomes.
Absolutely. I appreciate you taking the time to talk to us. Hopefully those numbers will continue to trend downward. And as you mentioned, it does take a village. It sounds like the programs that you've talked about are addressing some of those needs. Really appreciate you taking the time to talk with us.
Thank you so much.